More than a buzzword. It is an epidemic affecting many millions of Americans, especially children. No longer can we ignore what is considered public health's largest problem today. Obesity is having an excess amount of total body fat. A person is considered obese when his or her weight is 20% or more above normal weight. BMI is the most common measure of obesity. Typically, obesity is simply said to occur when a person consumes more calories than he or she can burn. However, the issue is not actually so plain cut, and many other factors are involved. With efforts to bring this national issue to scale in my own current area, I sought to explore childhood overweight and obesity in Richmond. To do this, I took an interest in child care and after-school programs, community perspectives, governmental and political, nonprofit sector, and organizational and corporate sector to look at exactly what Richmond is doing to play various roles in overweight and obesity prevention. This documentary is a look into the players in prevention in Richmond who work to combat overweight and obesity issues in very different ways.
Here at the Y, we focus on three aspects. We want to be for youth development, for healthy living, and for social responsibility. And to that end, we developed a nutrition and fitness program to help our 3rd through 5th graders focus on all those aspects: youth development, healthy living, and social responsibility. We want to be a program that helps them increase their knowledge in nutrition and increase their fitness activities as well. One of the reasons we started the program is our students now are in a fast food and Xbox generation, eating a lot of McDonald's or Wendy's and not a lot of time outside, not like when we were growing up. So we wanted to have a program that would give them knowledge about healthy ways to eat outside of going to the fast food places, and to give them some other choices besides sitting in front of the TV or playing video games all day. We were excited to be able to partner with the University of Richmond for this nutrition and fitness program. And University of Richmond were able to come in and implement the program that we had set up. It's really a 3-step process in the programming. We do a portion where we work on knowledge, increasing the knowledge about healthy eating. And then we do a fitness process where we maybe go outside, do activities. And we also do a cooking activity where the children get a chance to, get their hands in and cook something that they may not have eaten before. Some of the activities we've done is a food pyramid, so they learn the different types of food they should be eating. We cook things like turkey wraps and veggie salads, so nice healthy items, and kiwi fruits and vegetables. And for fitness, kids took a fitness test where they did, how many sit-ups could they do in a minute, how many jumping jacks. They did shuttle runs, and then we did relay races. So those were the 3 key elements. Overall, I think the program has been a huge success. In the short term, we believe the kids have been given knowledge and skills needed to live healthier lives, more fit lives. So they come in now and they have an understanding of what's an appropriate snack. They may talk about what they ate in school today and, better food items that they should be eating. And then long term, what we're hoping for is more active, healthier kids, less obesity, less, chronic diseases long term. But that's a process that's going to happen with us continuing through this process for the next couple of years.
In Richmond, the YMCA is engaging in very practical prevention measures, but no, it doesn't stop there. Other groups see the dire need to act to combat obesity.
Richmond that are working on preventing childhood obesity and overweight, and they vary from health centers to community-based organizations, schools, and even some non-for-profits have focused specifically in Richmond on making healthy food choices and helping parents to be more physically active with their kids. One group that's doing at the local level here in Richmond, similar to what the foundation is doing at the state level, is Fit for Kids. And the purpose of this organization is to coordinate efforts in Richmond. A group that's focused more on the weight management and clinical practice is the Virginia Commonwealth University Teens Program. And this is a weight management program that looks at both the child and the family to help do counseling as far as dietary behaviors, bringing in physical activity, and also looking at the behavioral aspects of healthy eating and physical activity. Another organization, Faces of Hope, is a nonprofit organization that actually goes into the home and looks at the family holistically, They tell stories of opening the refrigerator and seeing what's actually been purchased on the family food budget and how to be active as a family. So that's another organization that really is working with families and kids together. But then there's also organizations such as the YMCA and the Boys and Girls Club and other after-school centers that really focus on providing access to physical activity for inner-city children, for students after school or before school, and really making that link between maybe where the school time lets off and when the parents come to pick up their kids. And then there's also organizations such as healthcare centers and Bon Secours, which has taken the access to healthy food to a new level with their mobile learning lab, where they do take a van and they travel between communities to really provide nutrition education to families and the kids, providing sort of an overall community-based approach.
Sportsbacker is an organization who has also found ways within their corporate mission to address this pressing issue.
Very simply, back in 2005 in the spring, Sportsbackers decided to start our very own youth running program, which we called Fit for Life, which was basically a 10-week incremental mileage incentive-based running program for kids that was about 10 weeks long. We thought, let's have kids try and run or walk, encourage them to run and walk over a period of 10 weeks, maybe 2 to 3 miles each week, and then maybe they can culminate that, that last mile of their, so-called marathon, 25, 26 miles, by running our Kids Run event the same day as our Monument Avenue 10K. And so that program started in the spring of 2005.
The Foundation's mission was to work with youth in tobacco use reduction and cessation success with that. And the state looked at that and they came back to us and said, well, why don't we take a look at obesity prevention with youth in the state. So starting this past year, we took that on as a part of our mission and really expanded the work that we're doing with youth across the state. For the foundation, when we wanted to address obesity, one of the pluses for us is that we are a statewide quasi-state agency. We have the ability to go around the state, look at things regionally, we can look at them locally, and look at where the gaps are and where we can provide funding.
So one of the solutions is to continue to look towards those best practices and that evidence, the real data that shows that different interventions and strategies can work. Federal groups such as the Institute of Medicine and the Centers for Disease Control and Prevention have spent a lot of time and research hours to really identify the key strategies that communities can look to when they're starting their own childhood obesity prevention program. And so if we can all begin to sort of look together at those best practices and those strategies, then we can have collective momentum in addressing many of the childhood overweight and obesity issues. A mom who was in the audience raised her hand and asked she could ask a question or make a statement, and I said, sure. And she said, Heidi, I think you did a really great presentation, but I want to just share with you my personal situation. And she's a mom who lives in an urban area here in Richmond and wanted her kids to have the amount of physical activity they needed each day, but realized that in order to do that, the safest and best playground in her area was actually at the McDonald's. And really what that showed to me was that we're not just dealing with the issue of calories in and calories out. In this profession, we're also looking at what are some of the opportunities and issues with those calories in and those calories out. So for example, does the family have access to fresh fruits and vegetables? Does the child qualify for the school lunch program and can get the benefits that USDA provides? But really looking at the community as a whole and really what the issues are. And if the safe playground is at the McDonald's, really talking to that mother and seeing, well, what are the healthy options at the McDonald's that then you can feed your family. So really understanding that is multifaceted. There's not only one target that we're battling, it's a combination of those things.
Virginia Foundation for Healthy Youth is seen to share their focus based on actual health concerns of the current times. They are now tending to not only smoking cessation, but also obesity prevention. Richmond has a significant amount of childcare, after-school mentoring, and community programs. These programs are constantly seeking ways to address current problems such as obesity in the population.
It's a product actually of a young girl raised by her grandmother. And when you are part of a community that you don't have any resources, it's tough for you to thrive as a young child. It's the same situation here in Richmond. We have a lot of young moms and a lot of students who, just because of their economic circumstances, are not able to do certain things that maybe would expose them to an environment where they could see more, want more, and do more. We are the community. We are the community. We are working with the families, and we're working with the schools, because it's not just one. We all have to do it together. And I mean, with our situation, with our organization, if you are dealing with families with low income, well then now you have a problem with, can we even afford the better foods in the better grocery stores, or can we even have access to those grocery stores across town? I believe it's important as an after-school program to assist in this effort. Even at Youth Life, we try to provide healthier snacks, and also we have recreation every single day for the students. But I still even think we have a great responsibility and could do a better job. But it takes money, as everyone knows, to obtain these healthier. But for our after-school program, it's an issue. We get snacks sporadically that are more healthy, but we just don't have the resources currently to provide the students what we need. But we're very conscious.
Faces of Hope is Virginia's first ever in-home / a combination of group fitness and dance classes here in the Richmond, Virginia area. We service children 3 to 19, whether it's directly in their home with the weight management specialist, or they come here to the fitness center for dance and group exercise classes, as well as the dietitian services are all rendered in the home. If I could reverse that, and if I could do anything with any family to show and to prove to them that you can fight this thing and we can do it together, that's really why we started, really just to do it as a family. It was 1 in 5. It's now 1 in 3. Will it be 1 in 2 or 1 in 1? We don't want to wait that long. So I think the fight should start now.